Warm weather brings out fun activities, but it also brings out some serious hazards to your health. One silent killer is the same thing that gets us outside in the first place: the heat. I'm Dr. Adam Goodcoff, and today we're talking about heat stroke and heat-related emergencies. Summertime, especially in the northern regions of the world, is celebrated by many with extra time spent outside. Unfortunately, these populations are often less acclimatized to warm weather. If not careful, the body's temperature can rise quickly. In order to fully understand how this can become so dangerous, we need to understand how the body keeps cool. Thermal regulation is controlled in the brain and is one of the most important functions inside of our bodies. The skin is an impressive organ often overlooked and allows for temperature regulation in multiple different manners. The first and most commonly known is sweating. This allows for evaporative cooling as the sweat reaches the outside of our skin. Another mechanism would be known as radiation of heat, literally the heat passing through the skin and out of the body. But what happens when these mechanisms are overworked? Well, there are a spectrum of heat-related injuries, the most severe known as heat stroke, but we'll start with the basics of heat exhaustion. Heat exhaustion can be identified as dizziness, increased thirst, heavy sweating, and often weakness even with nausea. As you can imagine, with heavy sweating comes dehydration. This is often due to inadequate hydration or just not drinking any water at all. While heat exhaustion is dangerous, the real life-threatening emergency comes from heat stroke. Heat stroke is a progression from heat exhaustion where the patient now exhibits confusion, dizziness, and ultimately can become unconscious. The first step in any heat-related emergency is to move the patient to a cool environment if possible. Once this is done, we have multiple ways that we can expedite the cooling. The first is to use ice packs. These are often placed in the groin, armpits, and across the chest to maximize the cooling effect. In some patients who are suffering from heat stroke, we need to drop the temperature even quicker, and one of the fastest ways to do that after the application of ice packs is by convection, or wind passing over the body. As the cold sweat sits on the surface of the body, wind passes by, rapidly cooling off the skin as well as that circulating blood just below it. So next time you're spending your day out in the hot sun, remember not only to stay hydrated, but remember these tips to keep yourself safe from the high temperatures. If you learned something from today's video, please consider giving it a thumbs up, and of course subscribe to have your health explained.